Sure, yep. Hey, thanks, Natasha. So my name is Sarah. I'm here from the Department of Physical Therapy at the University of Toronto to talk to you a little bit about our Master of Science in Physical Therapy program. I'm going to tell you a bit about what the program's like, and then I'll tell you a little bit about what our admission process looks like. So physical therapy is a self-regulated health profession. Essentially, what physical therapists do is they try to prevent, diagnose, and treat movement dysfunctions. And how do they do that? They use things like exercise, modalities, education, and consultation. Where is PT practiced? So many places across the entire continuum of healthcare, and that includes things like private practice. It includes public sector care, rehab, long-term chronic care, and acute care. It's also practiced across the lifespan, so everything from neonatal right up to end-of-life care. And it's actually also practiced across all of the systems, which comes as a surprise to many people, even after they've applied to PT and they get into the program and then they realize there's a lot more to PT than they maybe initially thought. So I think most people probably think of physical therapy in terms of the musculoskeletal components. So, you know, your typical knee injury, sports injury, things like that, where you go in and you see a PT, they help you get back on your feet. That is definitely something that physical therapists do, but there's also physical therapists that work specifically with neurological disorders, cardiorespiratory issues, and of course, multimorbidity issues that cover many body systems. It's funny, I was talking to a student recently who said it wasn't until they got into the program and they went to their first cardiorespiratory lecture that they even realized there was cardiorespiratory components to PT. So it is quite broad, and you can always specialize after you get your degree if you want to learn more about a specific area. And of course, there's also options for PTs to go into health promotion as well. So just a couple of options, I guess, to kind of throw out there for you. If you're looking for what physiotherapists do within various roles, you can see a few examples here. So things like management and leadership and so forth. Careers, as I said, you can go into many different areas. We have people that graduate and become clinicians, and they're out there practicing and they have their own patients. We have other students who graduate and then decide they want to go into research. We have others that end up going into administration. You can be a teacher. Health promotion I mentioned before, advocacy and consulting are all options for people with PT degrees. So why study physical therapy here at U of T? We have a renewed curriculum. Our faculty have worked very hard on that. That was in the works for quite some time, and it's now been launched. I'll talk a little bit about the curriculum in a couple minutes. It's fully accredited, and this is really important. In order to practice as a physical therapist in Ontario, you need to graduate from an accredited program. Our program is accredited. Again, we have lots of different faculty here with various research areas. This was mentioned before with, I think, OT, but we have a huge option of clinical sites here that you can do internships at. Many of them are located in the downtown core. So that's one bonus of coming to U of T. You have access to all of those types of sites. We actually have over 200 clinical teaching areas, and they are not just in Toronto. They do range across the GTA, but we do have several that are downtown. And of course, you get all of the access to U of T's resources. So this is a little bit about our curriculum. A couple of things that were done to try and make the curriculum a little bit more cross-curricular. They looked at how to integrate things like context and practice, electrophysical agents, exercise science, IPE or interprofessional education. So that's where you get to work with other healthcare professionals, pain science, and SPEC, which is the social, political, ethical, and cultural implications. Here's kind of what the program looks like. It is a 2-year, 24-month full-time program. We only have classes that begin in September. You finish 2 Augusts after that. So the first couple of units are really just sort of a foundation where you learn the basics of the different body systems. So you're going to look at MSK, you're going to have a neuro, and you're going to have a cardio unit. That basically takes you right to the end of May in year 1. Then you go on your first clinical internship where you actually get to practice with patients and apply the skills that you've learned. You come back in the summer and you kind of put all of that information together. You look at some multimorbidity type of things. You talk about your internships. And then when you start up again for year 2, again, you're going to start off with a scholarly practice in September. So that's research. You get started on your research project. You have 2 more clinical internships. You have an advanced practice in your MSK, neuro, and cardio, and then you get to do your final internship in your research project. So that's kind of a quick overview of what the program looks like. We do have the highest publication rate of student research papers in all of Canada. So if you are somebody who's interested in research, it's kind of an interesting little tidbit there. A lot of the papers get published at the end of the program. So there's a couple examples here you can see of research projects that have been published. So our clinical education, so this is where you would go into practice with patients. We have 6 different categories. I've listed them here. And I've got some examples of some of our affiliated sites as well. But as I said, we do have over 200 different clinical sites. So you can certainly go onto our website. I've posted it there. We have all of them listed. You can see where they are. And essentially they go from Mississauga in the west, up to in the east, I think it's Ajax, and then north, I can't remember exactly how far north, but I know there has been stuff in rural Ontario before. It is quite far north. And we also have international opportunities and rural Ontario opportunities. So student life, I'll mention, we do have a very active student group in the program, as you can probably tell from the photos. They have a multitude of clubs. They are always up to something. They're always busy. They've got intramurals and so forth. So there's always something going on and there's something for everybody. So I'm going to move on now, talk about the admissions process. So we have 2 main things that we look for. One is academics and then there's the non-academic. So I'll talk about each of these things in turn. So academically, what we're looking for is a bachelor's degree with high standing in the liberal arts and science. To be competitive for PT, you are going to need an A- to an A average over the last 20 half credits, which works out to about the last 2 years of your studies. So to give you a sense of how competitive the program is, the GPA cutoff for the last couple of years I've posted here, most recently was a 3.78, and prior to that it was about a 3.81. We do have some prerequisite courses that we ask all applicants to have completed at the time that they apply for the program or to have in progress when they've applied for the program. So I'll go through those in a minute here. The prerequisite courses, we do ask you to have a 70% or a B- in each of these courses, and they have to be fairly recent, so within the last 7 years. So what we're going to be looking for is half a credit in physiology, half a credit in anatomy, half a credit in stats or research. And again, half credit courses are typically the courses that run for 1 semester. Depending on what school you've taken the course at, it might be 0.5 credits or it might be 3 credits. Full credit is we're going to ask for life or physical science, social science, humanities, or languages. So you can take, for example, 1 life science half credit and 1 physical science half credit, and that will suffice. You can take a combination of maybe 1 half sociology and 1 half French, and that will be fine. Or you can take 1 full, for example, philosophy, that's a humanities course, and that would be fine too. And again, full credit would be something that runs typically September through to the end of April. So depending on where you've completed the course, it might be 1.0 credits or it might be 6 credits. With respect to the prerequisites, it's really important that you check the prerequisites you're planning to use and make sure that we've approved them for the physiology, the anatomy, the stats, research methods. Okay, we have a whole bunch of different courses listed on our website for those. If you can't find the course you're looking for, it's probably because we haven't looked at it yet. So you can send us an email and we'll have a look. In terms of assessing your sub-GPA, we're going to be looking at the last 20 half credits completed by December 31st of the application year. So if you were applying this year, we'd basically be looking at everything up to December 31st, 2020. We do include summer courses in our sub-GPA calculation. And similar to what Aline was talking about with OT, if we need to go back to a previous year to extract grades, we use a weighted average of the whole year rather than picking and choosing which courses to use. This is called the ORPAS Undergraduate Grading System Conversion Table. So if you're applying, you apply through ORPAS, so that's like a division of OUAC, and this is how they calculate your sub-GPA. So you find your school on the bottom, you look to see what scale they're using. So for example, if you look at the first one, Acadia, they use a scale of 7. So you find the 7 column and you can see what an A+ works out to on the ORPAS scale. So an A+ is a 4.0 on the ORPAS scale, and a C+, for example, would be a 2.3. So that's kind of how you would use this. This is always updated on their website, so check the website, don't use this one. This is from 2017, but it should be similar. So to give you an example of what I mean by taking a weighted average, so let's take an example and let's say that you're in your 4th year of undergrad, and by December 31st of this year, you're going to have 15 half credits done throughout your 3rd and your 4th years. But we said we're going to use 20 half credits. So where do we get the other 5? We're going to have to go to your 2nd year. So when we look at your 2nd year, let's say you've taken a full course load, you have 10 credits completed in 2nd year. Well, we only need to use 5. So what do? We take the entire average of all 10 of your courses and we weight it at 5 credits. That way we're not picking and choosing which courses to use. We take the whole year and weight it at 5. Okay, so that covers the academic component. I know there's a handful of questions in the chat box. I'm going to answer those at the end. So I'd like to talk a little bit about the non-academic component here. We ask all of our applicants to complete something called the Casper. Some of you might have heard of this, some maybe not. The Casper is an online situational judgment test. You can complete it from any location. You just need a webcam and internet access. And this is intended to measure characteristics that we feel contribute towards the successful, I guess, development of a physical therapist. So characteristics that would help to make you a good healthcare professional, things like empathy, communication, ethics, and so forth. We're also going to ask you for 2 reference letters, 1 academic, 1 professional. So the academic reference letters are typically, you would ask a professor, someone who's taught a course that you've enrolled in, and 1 professional reference. So this could be somebody, maybe like a work supervisor or a volunteer supervisor. Either way, whoever you're choosing, make sure that they're able to address your aptitude for succeeding in healthcare. Make sure the person knows you. The next non-academic component that we're going to be taking a look at is the computer administered profile. We call it the CAP. So the CAP is essentially a written, it's a set of questions and answers. So we pose a set of questions and you write your response to them. It's not really a test. It's not something you can study for. It's not like the MCAT. It's more, I mean, if you're going to compare it to something, it's most similar to probably what you'd see in an interview. So what we do is we ask, we invite our top 350-ish students, or applicants, I should say, to write this. It is administered online, so you don't have to be in Toronto to write it. You can write it from wherever you are. As I said, it's most similar to something like an interview. We'll ask you a question, a written question, and you provide an answer. So you might have a question like, give us an example of something you've done, or describe how you might respond in this situation, and you just type your answer in. It is timed. It's 2 hours. The number of questions varies from one year to the next, but it's always more than doable in 2 hours. So how do we figure out who actually gets an offer of admission after we look at all this stuff? We start off with your Casper score, and we take essentially the top 80% of applicants based on Casper score. Then we take a look at the academic components, the reference letters. So this part is like your SubGPA, and we take our top 300 to 350 and we ask them to write the cap. Once they've written the cap, what we do is we give them a ranking. So we take 60% of their SubGPA, 40% of their cap test score, and we make that into their rank, 100% admission ranking. And then we make our offers. So in terms of how many offers we make, we anticipate 110 spaces in the program for fall of 2021, so this coming cycle. This chart gives you an example of some of our most recent statistics in terms of the number of people applying versus the number of people that get in, and the relevant GPA cutoff for that particular year. Applications I mentioned before are submitted through OUAC. They have their own division specifically for rehab sciences. Make sure that everything that you're sending in goes directly to ORPAS. Please don't send it to our department. ORPAS will upload everything and make it available to all of the programs you've applied to. So if you've applied to other PT programs in Ontario, they get your stuff too. The application deadline for this year is January 8th of 2021, so it's a few months away. My recommendation would be that you don't wait until January 7th at 11:59 p.m. to click on submit. It never works well. You want to make sure you do this ahead of time if possible. The server always gets really, really busy, and things slow down quite a bit as you approach the deadline. So just keep that in mind. And I should say you can actually start working on the application anytime starting in mid-October, so it's already open. You can fill in bits and pieces, save it, and come back and work on it later. So that would be my suggestion. Your Casper test, you can actually book that right through Casper themselves. The website is there. It will ask you when you're setting it up to put in an OUAC reference ID. For now, just put in your phone number. Once you've actually submitted your application to ORPAS, they'll give you like a confirmation number, and that's what we want you to go back and put in. But if you've got questions about that, you can let us know. We're happy to kind of walk you through that. So our contact information is here just in case you think of something you want to ask us afterwards, or if any of the chat questions that I'm going to take a look at in a minute don't get answered, just send us an email and we will try our best to get you an answer to your question. So now I'm just going to stop sharing my screen here for a minute, and I'm going to address some of the questions in the chat box. I'm just scrolling up to the beginning of the presentation here. Bear with me for a minute. Okay, so do we look at repeated prerequisite courses? Yeah, so we do look at repeated prerequisite courses. If you have taken a course, let's say you take an anatomy course or something like that, and you don't do as well as you'd like, and you decide to take the course again, that's completely fine. What we ask that you do on your application is we're going to ask you to list specific courses from your transcript that you want to use towards the prerequisites. So it'll say, what's the course code, what's the course title, and what was your grade? You tell us which ones to look at. So if you did better the second time, use the second one. Sorry, I see Alim's got some answers in here too, so I'm just going to scroll through those. Okay, so credit, no credit courses, those are not included in the sub-GPA calculations simply because there's no numerical value assigned to them. So we can't include them. Essentially, we skip over those. However, I should say if it says no credit, meaning you failed a course, then that will count as a fail, and that is included in the sub-GPA. So as long as it just says credit or pass, we can't do anything with it, so we pass over it. Okay, so here's a question about graduate courses. Graduate courses are not included in ORPAS's calculation of your sub-GPA, but when we get the applications from ORPAS, if you've done grad courses, we're going to include those in our manual calculation of your GPA. So yes, we will look at those. And they will end up getting counted towards the sub-GPA we use internally. How do you consider grad studies in related fields? So an MSc in kinesiology during the application process. Okay, that's a good question. You're certainly not required to have a master's degree in anything. We just ask for the undergrad. If you have a master's degree, that's just bonus. We're going to use the same ranking formula that I mentioned to you earlier, regardless of whether or not you have grad studies. So while it may not necessarily give you an obvious advantage, often people tend to do better in their grad studies than they do in their undergrad. So sometimes the GPA is reflected that way in the sub-GPA calculation. So something to keep in mind. Typically our people with grad studies do quite well, but it's certainly not necessary. Okay, so if you've been out of school for more than 5 years, how do you get an academic reference? So if you've been out of school, my suggestion would be that you try to reconnect with some of the professors that you did know while you were doing your degree. If that isn't really an option, you could try even just taking a course and getting to know the professor of that course. It could be even just like a course that you're taking out of interest. It doesn't have to be like specifically a PT course. Or perhaps you could look into certificate courses or continuing education courses and try and get to know the professor. There really isn't an easy answer to that question. You do have to have a professor who's taught you. So if you maybe start off with reaching out to your prior professors, and if that just isn't working for you, consider taking another class and trying to get to know the professors who are teaching you in those classes. For the professional reference, should they be able to attest to your ability to be a good healthcare professional, but can they be from a non-healthcare setting, such as a research supervisor? That's a good question, Angela. Yes, they can definitely be research supervisors. They do not have to be in a healthcare professional field. They can be anybody. We're really just looking for someone who can comment on what you're like, and you know, if you'd be a suitable candidate for a healthcare profession. So they do not have to be a healthcare professional themselves. So I'm just reading this question here. So if you're a mature student with a highly competitive sub-GPA except for one half course, will the application still be considered? Do you have recommendations for how I can enhance the application? Okay, so if you have a GPA that falls below 3.7, you're still going to be considered. We look at all of the applications, and our cutoff varies from one year to the next. So it depends on the specific cohort that comes in. I mentioned we take the top 300 to 350 applicants. So that's where we cut off. We look to see where our 350-ish person is in terms of GPA, and we use that as our cutoff. So I would say definitely apply. The other thing you can do if you're trying to increase your GPA and you've completed a degree already, you can always go back as what's called a non-degree student. I think other schools have different names for it, but essentially you go back and you just take courses on a course-by-course basis. You're not working towards a degree. If you are going to do that for physical therapy, we just ask that you make sure, if you're not taking prerequisites, that you take 300 or 400 level senior courses. So don't go back and take a whole bunch of 100 level courses just to get your GPA up, because we're not going to count them. Go back, take senior level courses, or take prerequisites at whatever level you want. Those ones will count. Okay, so here's a question about when you need to have prerequisites done by. So we strongly recommend that you have as many of the prerequisites done by the time you submit your application as possible. So try and get as many done as you can by December 31st of 2020. If you can't get them all done and you've got one or two in progress for the winter term, so from January to April, that's fine. You just need to make sure that we get your final grades for those specific prerequisite courses, and they do have to be at least a 70. I mentioned that, I think, before. The final cutoff in terms of getting us final transcripts showing not only your prerequisites, but also degree conferral is June. Okay, so as long as you can have the proof that you finished it printed by June, you're good. Okay, so if you're completing it in winter, that should be fine. Is there a due date for Casper tests? Yes, that's a really good question. So Casper has a number of test dates set up specifically for the physical therapy program. You need to make sure that you have written by, I believe it is in January, I just can't remember the exact date. So check the takecasper.com. It's got all the dates listed. You need to make sure you have it by January. The Casper is a requirement that we ask for. Some schools don't. So if you're applying to other physiotherapy programs, you may need to submit scores, you may not. I think I've covered most of the questions here, and I see that I'm just about out of time. So if there's
5 minutes.
Oh, do I?
You're the last person.
Okay. Do you have to complete Casper for each program or just once? So Nicholas, my understanding is you complete Casper once per year, and you ask them to release it to the various programs you've applied to. If you have questions about that, I would strongly suggest that you check with Casper directly. They can help you make sure that you've got everything set up properly. The other thing I'll mention too is if you do go on the Casper website, you're going to see this thing about Casper Snapshot and how it's like a really good idea to do it. Some programs might be asking you to complete that. Our program, we're not looking at it. So if you complete it and it gets sent to us, we don't really care. We're not going to open it or look at it. It's not going to be considered at all in the admission process for PT at the University of Toronto. So if you don't want to complete it and it doesn't matter to us. So that's absolutely not a requirement. So that you'll probably see it on their website, but for us, you don't need to worry about it. So I think I've covered most of the questions there. I'm gonna let Natasha introduce, I guess, our next person. Thank you very much. If you've got any questions, I'm gonna put my email address in the chat, and that's it. Thanks.